Hello, my name is Jennifer. I am the new staff development coordinator at Life Care of La Center. You should have a packet from the June 2024 meeting. Hate that you weren't there, but I wanted to go ahead and go over all the information and also go through the answers throughout this presentation. So the first thing, let's talk about state. They are actually in the area, and it's only a matter of time before they visit us. When it comes to our healthcare academies, we have a lot of people that are behind. Life Care assigns you on your anniversary date every year several modules. You have 30 days to complete those modules. My office is actually the old business office, and I have a desk and I have a chair and I have a computer that's here for you to come and use to help you get caught up on those healthcare modules. CPR cards. If you are a nurse, a CNA, therapy, I need a copy of your CPR card. Next, let's talk about enhanced barrier protection. That is gown and gloves. So if you are going to be with a resident that has a sign over their bed saying they have enhanced barrier protection, then you want to get that gown out of the bottom dresser drawer. Also, this is going to be for people with wounds. If they have any type of indwelling device, and if they have a multi-drug resistant organism or an MDRO. Now, if you're just brushing their hair, you don't need to gown and glove, but if you're going to have hands on, you better have it on. All right, let's talk about hand washing. When it comes to our residents, and they're going to the dining room, we need to make sure that they are using that hand gel before they go into the dining room. And if they're eating in their rooms, then wash their hands before you start their meal. Topic number 1. Well, we're going to talk about heat because we live in wonderful Western Kentucky where heat and humidity, it's the norm. So there's several ways that our body loses heat, and sweating is one of them. Over 95 degrees, it's actually the only way that our body can lose heat. Well, you add in that humidity, makes it harder for sweat to evaporate and cool the body. Sweating actually causes water loss, which can lead to dehydration. And if you don't have a whole lot of water in your body, kind of hard to sweat. If you can't sweat, can't get cool real easy. So what increases our chances of heat issues? Well, number 1, activity, especially if you're in the heat and humidity. So I'm talking maintenance, our dietary, housekeeping, laundry. Just know that you may be at an increased risk of heat issues. What about the high temps and the high humidity? No air conditioning, or maybe not good ventilation. Decreased fluid intake, which a lot of our residents struggle with. And several of them are already dehydrated chronically, and that can make them at an increased chance for a heat-related issue. Some diseases like hypothyroidism and diabetes can also increase their chance, as well as medications. So diuretics or water pills can increase the chance, as well as some of the heart medications and antidepressants. So how do we prevent this from happening? Well, in your packet, you should have a handout from the CDC, and they recommend 8 ounces every 15 to 20 minutes. So we have these handy dandy cups here at La Center, and you can see the line. Well, that's 4 to 5 ounces. So you're actually supposed to drink 2 of these every 15 to 20 minutes. In other words, not just 1, but 2 of these every hour. If you are outside, if you're sweating a lot, need to stay hydrated, but you don't want to drink more than 48 ounces of water in an hour. When it comes to sports drinks, CDC doesn't really recommend this unless you've been sweating for several hours or you've been participating in intense exercise for over an hour. Also, avoid alcohol and any type of caffeine. They can actually dehydrate you quicker because you're having to go to the bathroom all the time. Other things, take frequent breaks. I don't care how good that outfit looks. If it's got a heavy jacket or pants and it's 100 degrees outside, you need to be smart and dress for the weather. Also, fans, or get some ventilation going. Open those windows, open doors. So let's talk about the types of heat-related issues. The number one is going to be a heat rash. Now this actually is like a little cluster of red bumps, or looks like tiny blisters. And we treat it with cornstarch. You don't want to use any type of creams or lotions because that can trap the moisture and it makes it even worse. Next is going to be cramps. And these usually occur in the arms or legs or even the abdomen. If you've heard somebody say they've had a stitch in their side, usually caused by a deficiency of water and sodium or exertion in very high temps. That's one of the reasons you see it a lot in athletes, but you also see it with dialysis patients because they're losing both sodium and water. So we treat this by giving them water, getting them in a cool environment, letting them rest, stretch that muscle, or even pressure on that muscle. Those can all help decrease the cramping. Heat exhaustion. If heat exhaustion is not treated, it can actually lead to heat stroke, which can be fatal. So heat exhaustion is usually caused from heat and fluid loss, and you're not replacing it with enough fluids. But also older adults like our residents, those with hypertension, and those that work outside, like hint, 59-year-old landscape worker. If the heat index is super high, we can't even let our residents go outside and sit on the porch. So signs and symptoms. Well, they're going to have a lot of sweating. Their pulse is going to be fast. They might have chills even though they're sweating. They'll be extremely fatigued. They may have nausea, headache. So once again, rest, cool environment, get them some water, or in this case, the CDC even says a sports drink. Elevate those feet 12 inches, and they usually don't have to go to the hospital unless they start vomiting and they can't get the fluids in. Lastly, heat stroke. This is very critical because if they get to this point, their organs can actually start shutting down, so they need to go to the hospital. Signs and symptoms. We're talking about hot, dry skin, no sweating. They may start vomiting. Signs and symptoms of stroke like slurred speech, may have a change of level in consciousness. Hint, hint. They can also have confusion, dizziness, seizures. Their temperature may be 103, 104 or higher. You can also see this in older adults, even if they haven't been exercising, and with certain medications. So the treatment, we need to reduce their temperature quickly, but we don't want to do it too quickly because they can get hypothermia at 101 degrees. So how do we do that? Well, we're going to put ice packs in their armpits, back of their neck, and in their groin. We can also sponge bathe or spray them with water and put a fan on them to help cool that body. But we are definitely calling 911 because this can be very, very fatal. Topic number 2, it is National Dental Care Month. And your smile, it's one of the first things that people notice about you. So let's talk about good oral health. Why do we do it? Well, number 1, comfort. It just feels good to have a nice, clean mouth. It also helps food taste better, which is always a good thing. So food is good, okay? It can help our overall health, and it also helps decrease infections. It helps keep the mouth moist, which is very, very important for our denture wearers because that's what helps them to adhere. Now, when it comes to poor hygiene, well, number 1, they may have some funky breath. They can also have issues with plaque and tartar, and those can lead to cavities. Poor oral hygiene can also lead to periodontal or gum disease, which is 17 down. It can also cause our dentures not to fit right. It can cause pain, and all that can lead to malnutrition. So causes of cavities. Well, The most common dental disease in young people, 15 down, is cavities. But our residents are actually at an increased risk because of their age, and a lot of times because of their disease processes. What's some dried fruit here? Now it's fruit, right? Fruit's good for you. Well, in this case, dried fruit is usually very high in sugar. And sugar, as we know, can lead to cavities. Also, cookies, cereal, candy, all of this our residents, they love, but very high in sugar, causing cavities. And any processed food can actually increase the chance of cavities because they adhere to the teeth. Fresh fruit, like peaches, 11 across. These are great. They promote saliva and help digestion, and all that's good for your teeth. And by the way, 18 down is saliva. Meats, hard cheeses and meats is 10 down. These have none. So these do not cause cavities. They actually help to remineralize your teeth. Vegetables, I have a cucumber here. This does not cause cavities either, which is similar to meats, hard cheeses, and nuts. Any complex carbs, so fruits, vegetables, whole grains, beans, peas, lentils, those are actually all very low in causing cavities. Sweetened drinks. This is the most significant risk associated with cavities and things like sweet tea or any sugar-based beverage. Fruit juices are also very high in sugar and have a high chance of causing cavities. What about diet sodas? They're diet, right? These are also very high, pretty much as high as a regular soda. And it's because of the aspartame and the citric acid. I don't have any with me, but milk, dairy, and milk consumption actually helps your teeth to improve and reduce the risk of cavities. So let's talk about some oral health issues, especially when it comes to our residents. Malnutrition because of poor oral hygiene, and they have pain, or they get a cavity, or their dentures aren't fitting right. All of that can affect their chewing and lead to malnutrition. They also have an increased chance of cavities and an increased chance of periodontal disease, which is 11 down. Frequently they'll lose teeth or they'll have dry mouth. And that dry mouth, that can be related to medications, which can accelerate tooth decay. It also interferes with the way the dentures work. They're at a very high chance of receding gums. Well, when their gums recede, those roots are exposed and they don't have enamel on them, and so it leads to cavities. Diabetes can also cause progression of periodontal disease and expose those roots. So let's talk about how we brush our teeth. So number one, we brush our teeth to remove plaque. That's 13 across. We're going to use our toothbrush, which is 3 down. We want it to have soft bristles, 14 across. We want to change them every 3 to 4 months or more often if the bristles get to be frayed. So 5 across, we're going to do the 2 by 2 rule. We want to brush our teeth for 2 minutes, 2 times a day at least. So for 2 minutes, you can use an app for that, or you can separate it into sections: upper, lower, right, left. You want to make sure that you are brushing at a 45-degree angle, those outer teeth, and make sure that you brush the gums, all the chewing surfaces. And to get the inner part of the teeth, you may have to use a vertical motion. Just be careful, be gentle. Our residents' gums can bleed or become swollen if you use a lot of pressure. Our tongues, you want to brush those too. They have a lot of bacteria and also have a lot of bad breath that can be reduced just by brushing the tongue. When it comes to floss, 20 down, we want to make sure that we are doing that daily. We want to get between those teeth. And you actually need to use 18 inches of regular floss. And for every tooth you go to, you want to use a new section of floss. You can also use the dental picks, But you want to make a C around each tooth and rub up and down that tooth. Let's talk about dentures. We want to make sure that we handle those with care because they're very expensive and they're hard to replace. So we want to make sure that we are storing those in a denture cup. That way we are keeping the dentures moist so that they don't dry out and warp. And we want to make sure we're using lukewarm water or a dental solution. You do not want to use hot water because it can damage those dentures. Another thing, line the sink with a washcloth or a paper towel, because if you're like me, I'm a klutz, and if I drop those dentures, I do not want them to break or chip. No toothpaste. Toothpaste can actually scratch and damage dentures, so you want to use a denture cleaner. And also it helps to rinse the dentures after our residents eat, just in case they have any type of trapped food between the gums and the dentures. So let's talk about things to observe when we are doing our oral care. So we're going to look at our lips, 22 across. We're going to look for any abnormal dry, cracking. Do they have a cold sore, which is a fever blister? We're going to look at their gums. Are they inflamed? Do they bleed? Are they swollen? Have they started a new flossing routine, which can cause bleeding gums, and even blood thinners increase the chance of bleeding gums. Let's talk about teeth. Well, you definitely want to report any black teeth, which could be a cavity, any type of broken tooth, chipped tooth. We're also going to be looking at the mouth. Do they have any pain? Or do you see any type of white infection, pus pockets? Well, that can all be a sign of infection. Also, we want to look at the tongue. Do they have that white lace-like spots or patches on the back of that tongue, which could be thrush? We are very concerned because our residents are at an increased chance of thrush. And thrush, if that organism enters the body, it can cause sepsis or a bad infection. Look at their breath. Have you done all your oral hygiene and they still got some bad breath? Something might be up, and you probably need to inform either the primary care physician or provider or a nurse and just let them know. So let's talk about documentation. Number one, situation. Well, you definitely want to say, when you did it, but you also want to let them know what type of care that was done. And did your resident, or did they assist you at all? Background. Is there anything that they need to know when it comes to their oral health? Or is there medications that they're on that could affect their oral health, such as the blood thinners and the bleeding gums? Assessment. We're going to look at, what was their response? Did they do good during the procedure? Do we have any type of issues? Did we make any changes to that care plan? And recommendations. Did we have to call their PCP? Or did we have to let the nurse know about our observations? And if you got an order, make sure that you document that, and also that you fulfilled that order according to what you were told. So you may have noticed I missed one down on our crossword puzzle. The answer is fluoride.